Right, we're going to continue on now with the Ottawa Charter for Health Promotion, which we introduced last week as kind of a framework and guidelines for the delivery of health promotion programs. And it was developed in a World Health Organization meeting on health promotion in Ottawa in Canada, which is where that name comes from. We looked last week at the strategies of the Ottawa Charter. If you want to pause for a sec and see if you can remember what those strategies are, they were to advocate, enable, and mediate. When we looked at that case study around Australia's response to coronavirus and how you could put different parts of that response into these strategies. So, I mean, strategies, I guess, are ways that you will enable, or ways that you will introduce your health promotion program and keep it running. Probably the most important area that we need to look at, and the area that certainly comes up a lot in SATs and exams, so we'll actually probably spend a couple of sessions on this, are what are called the action areas. And these are 5 specific areas of the Ottawa Charter that are recommended to make health promotion programs successful. We'll go through each of these in a bit of detail, but it's probably good just to have them written down at the start of your notes so you can come back to it. So the first action area is build healthy public policy. There's create supportive environments, strengthen community action, develop personal skills, and reorient health services. Okay, so you do need to know the names of each of these, and you need to be able to link them to examples, which, like I said, we'll spend a bit of time on this, but it's always a good idea at this point to come up with a mnemonic to remember these. I think I've heard bad cats smell dead rats as one. Before Christmas, Santa dresses reindeer. Just come up with one that's going to help you remember these points, okay? Then jump into question 1. Once you've thought of a mnemonic, write it in there, because it's always good for me to get nice snappy ideas to share with other students. Okay, we're going to look at each one in detail. Make sure you have notes on this in your notes. You probably want at least a full page between all of them. But we're going to start with building healthy public policy. So this area, or this action area, relates to laws and policies that affect health and well-being. Okay? And the aim of these things is to make it more difficult to make unhealthy choices. If we think about health promotion being about people making healthy choices, we want to make it hard to make unhealthy choices. And those pictures probably give you a few clues as to examples of this, but things like having high taxes on cigarettes or alcohol. So it makes them more expensive, which hopefully puts people off buying them a lot. Okay, tax is a law. Okay, so businesses don't get to choose whether or not they charge the tax on cigarettes. They have to charge that tax. Another example would be things like having compulsory seat belts or speeding limits. There's lots of different examples when we look at road safety, traffic lights, drink driving limits, having to have a license in the first place. They're all examples of laws and policies. Smoking bans. Okay, so in Victoria, people can't smoke within 5 meters of the opening of buildings, or you can't smoke in dining areas. These are all laws. And also another one kind of to do with tax is when they removed the GST, the goods and services tax, on unprocessed foods. So the idea is that that brings down the price of unprocessed, healthier foods, which hopefully makes people buy them more. Okay, so once you've got those notes, head into question 2, and I want you to use an example and describe what building healthy public policy is about. Okay, the next action area is to create supportive environments. And this is about providing healthy physical and sociocultural environments to promote healthy choices. I think the physical environment part is quite easy to get your head around. Anything that makes a physical environment safer or healthier. The sociocultural can be a bit trickier. So these are basically things that we can't necessarily see, but that provide support to people. So shaded areas in schools and playgrounds, that's obviously a great example of a physical environment. Having safe working environments. So anyone who's got a job has probably seen a lot of these kind of signs around your workplace. They're to promote safety. I guess you could add in something like a supportive work environment where staff are friendly and supportive, and maybe you do social things together. That would be an example of creating a supportive environment. Even though it's not physical, it promotes health and well-being. Investing in sustainable energy. Okay, so when the government chooses to look at solar energy or wind energy, that's to make our physical environment healthier and also sustainable for future generations. And support groups is a really good example. And it's important to note that they could be face-to-face groups or online or even telephone groups. So like Quitline, which supports people that are trying to give up smoking, is an example of a supportive environment. Okay, so anything that supports people to make healthy choices. Once you've got those written down, jump into question 3, and again, use an example and explain what that means. All right, strengthen community action is the next action area. And this is about building links between individuals and the community. And it builds off that whole idea that public health and health promotion is about everyone. And to have these common health and well-being goals that we want to achieve, we want the whole country to be healthier. That's a resource for the country. You need to have those links between individuals and the community. So some examples are things like immunisation programs. Now they're actually things that are aimed at making the whole community healthy, and they also create these links between individuals and the community by allowing people to be able to go to playgroups and go to school and all of those things healthily. And often different community groups are involved in running immunisation programs. You've probably had immunisations done at school, you might have had them at your doctor, there might be community health clinics that have them. Who knows, by the time a coronavirus vaccine is available, it could just be that people go to a clinic set up near a shopping centre or something that might just be doing those things. Community activities, especially ones that focus on health, so things like fun runs are a really good example. When there are health services that are targeted to particular community groups, and especially when those community groups are very involved with how they are run, that is an example of strengthening community action. And there's some really great examples of Indigenous health services. There's some really cool ones that focus on increasing engagement in sport or healthy cooking or providing support to young mothers. They're all examples of creating that community action. And another really nice example is community gardens. You might have seen these around. This is when often the council or local government will release a bit of land, and anyone can go in there and plant fruit and vegetables. So people who don't have access to a garden at home can still plant these kind of healthy foods. And it's community focused. It's getting people involved. Okay, so just go and answer question 4 once you've written those down. All right, develop personal skills. And this is kind of, I mean, all of the action areas are important, but if we remember that health promotion is about educating people and giving them skills, that's really what this action area is about. Educating people and providing them with the skills and knowledge to improve health and well-being. Okay, we talk about this a lot. If people don't know how to improve their health, then they're not able to improve their health. Okay, examples of developing personal skills. So things like ad campaigns, all of those things you see in the newspaper or on TV or radio ads or even ads on social media, all of those health messages are about developing personal skills. They're giving people knowledge and often skills to improve their health. Healthy cooking classes. So a lot of hospitals or health clinics might run healthy cooking classes for people. Parenting classes are a big one. Again, we talk about health promotion as being something that is knowledge that can be passed down through generations. So it's really important to start with giving young or new parents information about good nutrition and physical growth and language skills, all these things that can be quite overwhelming for a new parent. And community exercise classes are another really good example. You might think, oh, well, this is strengthening community action. Some examples can be more than one action area. Okay, so don't be afraid to start drawing those links and saying, oh, that's a little bit of a few different things going on. Okay. So once you've got those, go to question 5. Okay, and the last action area is reorient health services. So if we talk about, orient is kind of another word for direction or to direct. So to orient something north is to direct north. So to reorient is to redirect health services. And the idea here is that the health system has kind of changed from being really focused on diagnosis and treatment, like in our biomedical model, and is focused just as much on health promotion and prevention, which is our social model. Okay, so it's not saying that we don't diagnose and treat conditions at all, but that we use the resources and the people we have in health services to promote healthy messages. So some examples of that are, if someone goes into the doctor because they've got a throat infection, they'll still get treatment for that, but the doctor might also give them a bit of education if they're overweight, for example, a bit of education about their diet or about trying to quit smoking. So using doctors for their education and their knowledge, not just to treat conditions. Another example is having physiotherapists running group exercise classes, and these often happen in hospitals for people perhaps with heart disease or lung disease that kind of need supervised exercise, but the point is to prevent further illness. Or another one, and you might have had something like this at some point in your schooling life, but having ambulance officers come to schools and run seminars or sessions on things like road safety or even on things like binge drinking. These are quite common issues that ambulance officers deal with. So by going out and educating people about these things, it's aiming to prevent road accidents or drinking related accidents occurring in the first place. Okay, so hopefully they make a bit of sense and you can go in and answer question 6. All right, I just want to give you a bit of time for the rest of this session to look at examples that relate to one goal. So it can be a bit confusing when you're looking at all different examples, but it's not surrounded on one health program. So I want you to go to this website. I've put the link in the Google Doc and it has a list of 5 different strategies. I'd like you to choose either road safety or the National Binge Drinking Strategy. So you just click on that and it will go down the page to that area. And I just want you to, you can link further into the website for that program if you'd like to read a bit about it. But I want you to just write down what is the goal of that program, why does it exist, or what is the need, and then give at least one example for each action area, and they are listed down in their website, that relate to whichever one you have chosen. And that should give you a better kind of view of what one health promotion program would look like.